Good afternoon, everyone.
Good afternoon.
And we're happy you could join us for our final session of 2023 on Medicaid Mondays. And we've had a good 11 months and 11 sessions, all of which you can find on our website. But I just want to remind you that Pierro, Connor, and Strauss has grown. These are our attorneys. We're at 16 now. We have 17 and 18 in the hopper, if you will, that are going to be joining us early in 2024. And we're very happy to work with you in any of our offices, whether it be Albany, New York City, Garden City, Massachusetts, New Jersey, Connecticut, and Florida. But we're happy to help in any way that we can. And today we're going to go through a number of things, three things. These are the sessions. And if you haven't seen any of these, they're on the website. They're 30 minutes. You can go back. And especially the things about Medicaid eligibility, home care applications, nursing home applications. We're going to give you a little bit of refresher on our top 3 picks for tools and techniques for the year. And then we are going to be repeating the sessions next year. So we will be doing 2024 Medicaid Mondays as well. So we're going to cover the Medicaid numbers, 3 tools and techniques, some takeaways, and then looking ahead, what do we anticipate is going to come in Medicaid in New York State in 2024? And Aaron, we had a big increase this year.
Yes, we did. And I would not anticipate a huge increase, although it will be indexed for inflation, which we all know has been fairly substantial. So there will be maybe a $2,000 jump in asset limit, that kind of thing.
So the bottom line there is the increase over 2022. And for single individuals, the asset number this year is $30,182. That's $13,382 more. And as Aaron said, that's not going to happen again, but you will get an inflationary increase. Couples now $40,821. And our income number, which did go up substantially as well, is $1,677 plus a $20 set aside, or $1,697 for those who are applying for Medicaid home care. And Medicaid home care, Aaron, is something that we focus on.
Absolutely. Almost virtually every client wants to stay in their home. And how do they do that? Most of them can't pay for it alone. It's kind of a public-private partnership, if you will, when you use Medicaid. Hopefully you're using more of the public portion of that, but a lot of times you do have to add to it with your own funds.
And in the Medicaid 30 minutes that we did earlier in the year, we went through the various Medicaid programs. You have consumer-directed personal assistance program, and we actually had a separate session with someone from the consumer-directed program to cover that, because that's allowing you to hire people either from your family, friends, relatives, other home health aides that are not agency aides, and have Medicaid pay them. Consumer-directed is so important, but we also have the managed long-term care program, 2 waiver programs that we deal with frequently, nursing home transition diversion, TBI. You should go back to that home care session if you want to learn in depth and detail about all of those. But what we're going to do, Aaron, is take a case study and walk our audience through this case study to show how the pieces fit together for Medicaid eligibility.
Very common story. Person in their 80s has a fall at home, and they go to the hospital. They've broken a hip or a leg or a wrist. They go to rehab for a period unknown. People will say, well, mom or dad or whomever gets 100 days of rehab. That's really not how it works. It's important to realize that. You get 20 days if you are medically in need of it. That's fully paid for by Medicare. And then day 21 through 100, there's a copay. Sometimes people's health insurance picks that up, or a portion thereof. But that does not mean that the person will be in rehab all of that time.
So there's an enormous amount of triage that has to go on when someone does have this event, whether it be a stroke or a fall. And that triage includes, is nursing home going to be the reality? Is home health care possible? What are the resources available to them in the home to bring them back home? These are all things that we get involved with as a law firm. We work very closely with care managers to make sure that the plan gets put in place properly. But when you're doing this, you have to look at the cost, Aaron, and that
Absolutely.
Cost is really what blows people away unless they have thought about it. And Don't think Medicare is going to cover long-term care. It does not. So we deal with this from, I'm going to pay for it. I have an insurance policy. I've been fortunate enough to keep my long-term care insurance policy and have one, or Medicaid.
That's right.
And nursing home costs right now in the capital region, around $16,000 per month, which is over $200,000 per year. Home health care costs can be even more. And that's a surprise for most people. If you're leaving the hospital and you need to go to a home health agency and you need to say, okay, for now, I need 24/7 care. I don't have Medicaid. I'm going to pay for this out of my own pocket. $35 an hour, 24 hours a day, 365 days a year. The number is about $260,000 per year. And so those are the things that require us to do some careful planning. Hopefully people have planned in advance, but if they haven't, Aaron, there are still things they can do.
That's right. So here we have mild memory loss, which means we more than likely can still do planning documents, as long as obviously somebody knows who the people in their life are, who would get their assets and what their assets are. If things get further down the hill, then we have other problems, but hopefully she's even done these documents ahead of time. Obviously, the much better way to do that. Still verbal, which makes things a lot easier. And there usually is a child or sibling or someone nearby, and that person becomes a lifeline to the candidate.
And this is the area where you're dealing with hospitals, doctors, discharge planners, home health agencies, a whole world that people are uninitiated to, and you are a pawn in the game. This is not a system built for people, it's a system built for the system. And when you go through it, you realize that discharge planning is nothing more than, okay, here are 10 options, find one, right? Figure it out. And so that's why we work with groups like Everhome Care Advisors and other care managers who can, and they're right here in our building, who can help put this plan together. But in this case, we've determined, having gone to the discharge planning meeting and having consulted with the family and looked at the home, that Rachel is a good candidate for Medicaid home care. And that's not a determination that they tell us, that's something we're going to determine, and that we need to advocate for 10 hours a day of care. So she has some resources that need to be dealt with.
That's right. So we have some income. 99.9% of cases, income is never going to disqualify someone from Medicaid. That's a common misconception that people have. The only way it could possibly, quote, disqualify someone is if you could pay for the care yourself out of your income, which is going to be very, very few people. She owns a home. She has a retirement account with $75,000. She has some money in a savings checking and a brokerage account, which will all be treated differently.
And not many people have 15 to 18,000 a month of income.
Right.
So Medicaid is going to be the lifeline. It's going to be the help that you need to stay at home and afford the care that you're going to get. And they have exemptions for a number of assets.
That's right. So asset limit is $30,182. That certainly covers her bank account in this case. The home is exempt if you have a spouse living there or a minor child, which is unusual in our cases. Sometimes we have a disabled child living there. If the spouse is living there, it's really just a short-term fix, because generally speaking, they're in a similar age and health situation. So it's okay, but better to get out and plan ahead of time for that. Prepaying a burial for you, your spouse, that's exempt. You're going to have to make that payment one way or the other, so better to pay for it off the top here. Income producing business assets, not relevant here, but if she had a rental property, that would be one way to exempt it. Very minimal life insurance protection. Here she has an IRA of $75,000. She's 84, so it has to be in payment status, so it will be exempt.
So that's a major exception.
Right.
Your home, your IRA, we can exempt those assets long-term for the home if we do it properly. The IRA, we want to make sure we have proper beneficiaries so it doesn't pay back to the estate. But other than that, 30 grand is what you get to keep. Minimal life insurance, a car, and you can prepay your burial and funeral. When you give assets away, there is a look back period and there is a penalty period. And these are two things that I think most of our clients have misconceptions about.
Right.
When you go to a nursing home, only nursing home, and apply for Medicaid, you have a 5-year look back. So we have to compile 5 years of financial statements and bring them with you. We'll talk about nursing home applications more in a moment, but that's not true for home care.
That's right. So you could have $1 million in your name this month and be eligible for Medicaid next month. If it was all housed correctly, whether it was exempt in a trust or moved around to a spouse, home care eligibility can be accomplished very, very quickly with little downside.
So when you apply for home care, you bring only current statements. What is the first day of the month balance in your accounts? So we work very hard to hit that target, the first of the month. So if you came in today, we'd be targeting January 1 as the financial eligibility date, and we'd be moving assets around, which we can do without penalty. If you need a nursing home, then you take any transfers that you make, divide it by the divisor, which is the average regional rate for nursing home care in our area. There are 6 regions of New York. Northeastern New York is a little over $12,000 a month. You divide the value of transfers by that, and that's your penalty. But for home care, that does not apply, which is very important to remember. So how are we going to do this for Rachel?
Sure. So let's deal with the income first, because in Medicaid, we have to separate the world into income and assets. Rachel is $648 over the monthly allowance. So the monthly allowance of $1,697 is going to continue to go into her bank account every month. She can do whatever she wants with it other than essentially give it away, but pay for things, food, extra care, rent, taxes, whatever it need be. The 648 goes into a pooled income trust where it is used for her benefit. Generally speaking, we try to set this up on a monthly basis where you use all of those funds within the month, whether it's phone bills and electric bills or whatever it may be. It just has to be bills related purely to Rachel.
And if you have a lot of income to dispose of, we don't want it to build up in that pool trust, because what's left over doesn't come back to the family. It goes to a charity, a not-for-profit that's running the pool trust. That's the cost of doing business. But we come up with a budget every month to drain that pool trust, including things like caregiver agreements. So if you're a child or a relative of the individual who is needing Medicaid and there's excess income, we will do an agreement, a written contract where you agree to perform certain services. You can get paid out of the pool trust. In certain cases, we have to pay consumer-directed aids for other things other than what Medicaid pays them. And this is how we get competitive, because the reimbursement rate under consumer-directed is about $16 an hour, going to $17 next year. So we have an ability to use this pool trust money to hire them to do other things and give them some extra income. But when we do this, the pool trust saves the income, the Medicaid trust saves the assets, and that's it. That's the next transaction.
That's right. So the Medicaid Asset Protection Trust is a type of irrevocable trust. Okay, Rachel's going to be the grantor, the creator of that trust. She's going to move her brokerage account in here and her house. Okay, she's going to keep her house out of probate by doing this as well, which is important because there would be Medicaid recovery against that house. But she can still have access to any income thrown off by the brokerage account, and maybe even access to principal if done correctly.
And again, March 2023 video is on our website. In-depth coverage of the Medicaid Asset Protection Trust. But the advantage is, Aaron, we avoid probate, which is a major issue.
Yes.
You don't want to have to go through court. We can distribute outright to the beneficiaries, or we can create further trusts, something we call beneficiary control trusts or special needs trusts. We can hire and fire the trustees at any time. We can change the beneficiaries at any time. We can access the income from the assets. We have the right to live in the house. And in New York, with the consent of the beneficiaries, even though it says irrevocable, we can revoke it. So the results here
are Rachel has $25,000 in assets, and she has income that allows her to qualify for Medicaid. She is not actually destitute, but qualifies for Medicaid.
So from a financial perspective, Medicaid Asset Protection Trust, Pooled Income Trust, we can create financial eligibility under today's rules very quickly. Those rules may change over time. We're waiting to hear if we're going to have a penalty period for home care, which has been pushed off several times, not in effect until maybe 2025, with no definitive answer from the Department of Health. So Medicaid home care from a financial perspective works extremely well. We did a whole session, a 30-minute session on the application process and the assessments. That's a whole different game. We can get you financially eligible, but then you have to go through a series of steps before Medicaid actually pays for the care that you are able to find. So let's move quickly to the nursing home scenario.
That's right. Different rules. Okay, here we have the 5-month look back period that everybody talks about. So we're going to move on to a different case study, and this is Bob. All right, Bob has more income. He has $3,550 of income every month. He has $361,254 of non
Random number.
Yeah,
No, not exactly.
no, exactly. And here's a big issue, right? He has gifted essentially $153,000 within the look back period. So what can we do for Bob to make him Medicaid eligible?
So when you do your audit, we audit these applications. We do the applications for our clients. We go through every statement, every canceled check, every transaction, because you don't want to be surprised when you're doing the planning by transactions that occurred within the past 5 years. So it is a rigorous review, something that you have to go through, because you don't want social services to kick up a check that you gifted away 4 years ago for $50,000 that throws the whole plan asunder. So careful auditing of all of these records in a nursing home application is important. Again, home care, no look back, just current statements. Aaron?
Important to note too that the burden is on the applicant, right? So if there's a check that is questionable and you can't prove that it wasn't a gift, it will be treated as a gift. And so if gifts are made or expenses are paid for, it's very important to document them other ways as well. So here we have gifts that would be a problem. Okay, those gifts create what we call a penalty period. And Lou talked about the divisor before. We have a regional rate that tells us what Medicaid thinks that or pays out the average rate of a nursing home. It's not really the rate, but when other lower rates are factored in, that's what we get.
It's 120% of the Medicaid reimbursement rate. That's what they use for the private pay rate, which isn't close, but that's what we have to work with.
And also very important to know, so you can't run a penalty period unless you're in a nursing home. So this is one of the ways they make sure that they get as many people as possible to pay for their own care.
It's a trap for the unwary.
Right.
So if you have gifted assets and you apply for Medicaid and you're not yet in the nursing home, your penalty period has not yet begun to run. If you are in the nursing home, you still have to be otherwise Medicaid eligible, which means you have to have less than $30,000 and you have to apply. So you have those three factors. These was put in the law in 2006 to trap people, to keep people from being able to gift assets in what we call a rule of halves transfer. You used to be able to gift half the assets, keep half the assets, use the half you kept to pay the nursing home, have the penalty period run on the half that you gifted, and you see the 12-month penalty here based upon $152,000 transfer with a $12,744 divisor. These are numbers that we have to deal with, and you have to be to the dollar, maybe not to the penny. But this is an accurate calculation that has to be done in advance. So after 2006, we kind of re-engineered the rule of halves, and we had to bring in a second element there.
Yes, and that was the chocolate chip cookie. So, this essentially still runs the same, that people think of it as a rule of halves transfer. Okay, so you do a gift and a loan, and the loan, according to maybe not logic to a lot of people, but is a non-countable resource that's been litigated and deemed to be that way. So what you do is you have countable money and non-countable money, and this is really the only way that you can fix these prior gifts. And this is not something that you really can do on your own because it's a very detailed and complicated process.
You have to factor in your income. You have to factor in the cost of the nursing home, the potential changes in those two numbers, the amount of assets that you have that are non-exempt assets. So we try to exempt everything that we possibly can. When we're doing a nursing home case, we spend as much money as we possibly can. So you can prepay funeral and burial for the individual, their spouse, their children, and the children's spouses. So we literally have funeral spending sprees where people go out and can spend $100,000 on 10 people's funeral. And that money is not considered a transfer for Medicaid purposes. So there are a lot of steps that go into the nursing home Medicaid process. Those are steps that we take with our clients. At the end of the day, when you sift it all out, you have a certain lump sum of non-exempt assets. You're going to gift a portion of that, roughly half. You're going to loan a portion of that, roughly half. And you're going to use the loaned money to pay the nursing home.
Absolutely. So again, we want to prepay as much as we can. That can be funeral costs. That's a big one, right? We're always going to have to do that. Prepay our legal costs, which we're obviously big fans of. All right. And then we get into our calculation. So as you can see, just from here, it's not exactly the easiest word problem. It doesn't involve trains going different speeds, but it's pretty close. All right. So we
Tuesday is when you're gonna get there.
That's right. So we get to our number that we have, 361, but don't forget, we have to add in our prior gifts. Okay. The only things we get to subtract are spend down, which was funeral costs and legal costs, and the resource allowance. So while it looks like Bob only has 297,000, according to the Medicaid rules, he really has more like 150,000 or 450,000.
Because of the prior transfer. So Bob's gonna gift, in this case, $72,072 to a Medicaid Asset Protection Trust and loan $225,000 to Robert Jr. He's gonna do that on December 28th. Total gifts of $225,000. What was gifted to the trust plus the prior gifts. We have to add them together. That results in a penalty period. You divide it by 12,744 of 17.66 months. And now we have a loan, which is going to be used to private pay the nursing home. And the numbers work pretty well there. I think
It's weird, right?
because the income is enough to cover the shortfall in the private pay rate to the nursing home. So in this case, we're going to private pay for a period of time, but we're going to have Medicaid eligibility in place on July 1 of 2025. And in total, we will have saved the $225,000 prior gifts and current gifts, plus the $30,000 exempt amount. If he had an IRA, that would also be an exempt amount. If there's a home with somebody living in the home that's exempt, that's also an exempt amount. So every case is different, every case is unique, but this is how we reinstituted the rule of halves transfer. It is a complex transaction, one of the most complex we have in Medicaid, but it's something that is absolutely doable and possible.
I think something important to note is sometimes people are going to go ahead and private pay and they're going to get to an amount that's too low to save this amount.
Right.
So you really need to get out in front of this problem if prior gifts have been made, because it can be fixed while there's still funds around, but you can, if you spend all the way down and you have prior gifts, you're still ineligible to receive Medicaid.
Yeah, we've had clients come to us that said, well, I just spent $300,000 over the last 2 years on nursing home care, and I have 150 left. Can you save some? And we can say, yeah, we can save half, but we could have saved half of the 450 instead of half of the 150.
Also true.
The sooner you start doing this, the better. Needless to say, this is the end result, 277,182 saved, and Bob goes on Medicaid July of 2025. Again, Medicaid March 2023, Medicaid Monday. There's also a full 30-minute session on the rule of halves transfer, which is in the deck as well. That was June. And we would refer you back to those if we're going fast here, if you want to get a more detailed and slower paced explanation of the home care transaction and the nursing home transaction. And next, we're going to just talk briefly about one of our favorite cases, and that is the case of Stanley.
Right. So Stanley has a disability. He worked for most of his life, saved a significant amount of funds, knowing that he was going to need some funding to carry. It's very important for Stanley. He wants to stay in his home. It's a family home. It's where he's lived for a long time. He came to us. We set up a Medicaid Asset Protection Trust for him, and we did a Medicaid application for him, knowing that he was going to need significant hours. He was actually already paying for fairly significant hours out of his own pocket.
Yeah, he had his own home health aide that he had hired, and he was paying privately for that home health aide, applied for Medicaid, and got denied.
That's right. Which is kind of mind-blowing. He was granted only 5 hours a day, which, you know, people have to use the restroom. I don't know how else to say it. And you can't really do that if you get 5 hours in the middle of the day. Someone like Stanley needs help transferring, needs help, you know, doing lots of things. And it really just was not going to work. It was going to leave him in a very, very unsafe position.
And we want to thank Stanley for allowing us to use this case. We have, many of you know, an elder law forum every May, and we'll be doing it again this May. So get get your reservation in. And Stanley was kind enough not only to allow us to do a video of him, but also to appear live and come to our elder law forum, where he got a rousing standing ovation. And his case is one that has been repeated many, many, many times, and it is a travesty that someone in Stanley's condition and situation, having worked his entire life, paid taxes his entire life, now needing care, and clearly needing care based upon his own physician's recommendation. But the system is not built for Stanley, and the system is not built for any consumer who wants to get the benefits that Medicaid provides.
So Stanley followed the rules and he did an internal appeal, okay? And they said, you know what? You're right, we got that wrong. It's 6 hours.
And 6 hours compared to 5 hours didn't make a bit of difference to Stanley.
Correct.
And so in this case, we were working with a care manager from Everhome Care Advisors who helped build the medical case, put the medical records together, helped advocate for Stanley throughout the process, helped coordinate his care throughout the process. Frank Hemming did the fair hearing, and we went to the fair hearing, and we hadn't had a decision yet when we had our elder law forum. And so we didn't know if we were going to win or lose, but we were brave enough to have Stanley appear. But as it turns out, Aaron, it went well.
That's right. So ultimately, we prevailed. We had strong evidence that Stanley needed care for 16 hours. The fact that he was already paying with his own funds for that amount of care is strong evidence. Obviously, there was strong medical evidence and just general safety that needed to be taken into account. So it took a long time. And unfortunately, what the denials are really forced to do, forcing people to spend their own money and deny services, because ultimately, at the end of the day, that's really what the home care system is now built for.
Yeah, still Stanley was able to achieve his end goal, which was to get his home health aid paid for so that he could live in the family home that was part of his life. And the unfortunate part is that during the pendency of all of this proceeding, he had to pay $72,000 out of pocket to get the rights that he was entitled to and the care that he was entitled to. And there is no reimbursement for that.
Right. We're often asked that.
There used to be. Once upon a time in New York law, there was reimbursement for private pay home care pending Medicaid approval and implementation. But that went away. The state took that away. Why? Because this is part of the game. Delay, deny, delay, deny. That's the Medicaid system. Fair hearing is your right, and it's a way to go through and get an independent administrative law judge to review this with fresh eyes and to apply the law. We have coming up a master plan on aging that I've been part of. I've been on a committee attending meetings. I'm not sure what the end result of this is going to be. Anytime you do something like this at this scale, it tends to be very watered down results and not terribly specific. But the master plan on aging is going to come out and is going to impact everything that we're talking about here. How do people get care? How does it get paid for? What's going to be available from Medicaid perspective? And Aaron, one of the big travesties is there are a lot of people out there that would love to hire home health aides that just can't find them.
Yes, and this needs to be a focus, training people for this purpose, letting people know that there are dollars and jobs available in this space and how critically important it is to people out there.
So we will be tracking all of the changes impending through the master plan. We are very close to the New York State Department of Health, New York State Office for Aging, and there are great people trying to do good things within the system, but the system is badly broken. And so it requires advocacy, and I hope every one of you out there is being an advocate for the clients that you serve, or if you're a caregiver, for the person that you're caring for, because this system does not give you the things that you're entitled to. You need to fight for them. And I think that's kind of the bottom line takeaway. Certain things we know, certain things you just don't know what that answer is going to be. The one thing is the number of hours of care for home care. That's where the battle is waged. So the financial piece we can do. We work with care managers to do the medical and healthcare and home care piece. And we work with some wonderful providers of home care to make sure that people are taken care of in the way that they deserve. So we will be coming back with all new numbers, all new rules at some point in 2024. And we will hope that you can join us again. Our website has the past shows, and we would recommend them to you. You can take your time, digest them a little bit easier because they go at a little bit better pace. So we covered 3 of our highlights today. Also, if you are interested in the Elder Law Forum, just shoot us an email, info@pierrolaw.com. And you can always go to our website, pierrolaw.com, to register for upcoming events and other things that you may be interested in. And of course, all of our guides will be updated for 2024 and available on our website as well. So with that, we are concluding our formal 2023 Medicaid Monday program. Aaron?
Season 2 will have twists and turns as well, so tune in.